So today we're going to talk about atrial fib. And the reason we're talking about atrial fib is a couple of videos that we've had recently. One of them was the most popular we've had yet, aspirin. Why would aspirin, depending on how you pronounce it, why would aspirin be our most popular video yet? Well, it turns out that there's a lot of butchered, messed up interpretations of the preventive medicine recommendations for aspirin and their recommendations to help you prevent dying early or becoming permanently disabled. One of the reasons why aspirin then created a whole bunch of interest and questions about atrial fib is when not to use aspirin. Even though you may have cardiovascular disease and aspirin may be indicated, aspirin doesn't help if you have atrial fib. And what's the issue with atrial fibrillation? It creates 5 to 8 times the risk for stroke that someone who doesn't have atrial fib has. So stroke is vicious. It is the number one cause of permanent disability. And there's only one thing that causes more strokes than atrial fib. Both of the things that cause strokes, the number one and number two cause, you most often don't know it when you have it. We've already documented it multiple times. 90% of people that have prediabetes, the number one cause of strokes, don't know that they have prediabetes. If atrial fib is number two, then how would people not know they have atrial fib? They don't. It's not 100% clear why they don't, but they don't. We'll talk a little bit more about that in a few minutes, and we'll talk a lot more about that in the upcoming video. I think it's coming out next week on atrial fibrillation. But here's the other video that brought up atrial fibrillation. Cialis. Cialis is our number one trending video right now, and it's like, you think Cialis is about ED, and yes, for most people, Cialis is all about ED, but Cialis is about a lot more, especially for boomer men that by the time you're age 50, if you don't know it, you've got 50% probability of having prostatitis, or at least benign prostatic hypertrophy. LUTs, lower urinary tract symptoms, having to get up and go to the bathroom in the middle of the night, and waking up and not being able to go back to sleep. So why would Cialis, a video about Cialis, why would that bring up atrial fibrillation? Well, here's the thing. A few viewers looked at it and said, hey, wait a minute, don't you realize that Cialis causes atrial fib? You see me rolling my eyes. The PDE5 inhibitors, and don't turn the video off because you heard that technical geek term, PDE5 inhibitors. They are associated with atrial fib, dysrhythmias. But it's not what you think. The folks that are saying, oh, you know what, I'm not going to take Cialis because it causes atrial fib. Or even differently, Cialis is contraindicated with atrial fib. Neither of those is the correct interpretation. Take a look at the upcoming videos. You'll get a little bit more understanding about the relationship and the concerns about atrial fib and Cialis and Viagra. But in short, I have atrial fib, paroxysmal atrial fib, and I do take Cialis. And it's not so much for ED, it's for something else. Remember we talked about LUTs, lower urinary tract infection, or lower urinary tract symptoms, getting up to pee in the middle of the night and not being able to go back to sleep? That brings me back to atrial fib. And I'm just going to take a few more minutes and share my own story. That's what these Friday events are about, sharing my own story on something that I'm working on right now. So the bottom line is my interest in cardiovascular disease is not just professional, it's personal. I have plaque, so therefore I'm a cardiovascular disease patient. My interest in prediabetes is not just professional, it's personal. I have prediabetes. In fact, I've during some testing have met the criteria for some definitions for full-blown diabetes. So I can honestly say I'm a diabetic. Um, Atrial fib. So let's go back about, I don't know if it was 8 years ago, maybe 10. It was one of those mornings that I woke up at 2, 3 in the morning. Usually when I wake up at that point in time, it's okay, see if I can go to the bathroom. If I can get by without going to the bathroom, I want to try that because getting up and walking around wakes me up. But then if I do go to the bathroom, I want to come back, be very, very still, maybe listen to an audiobook to get myself to go back to sleep. That wasn't what happened that morning at 2 in the morning. That morning at 2 in the morning, I immediately thought of a trip I had taken to Door County in Wisconsin. Now, why was that? Because it felt like I had a fish flopping in my chest. Quick digression on that trip to Door County. Uh, my wife had a professional meeting. I don't remember if it was Green Bay or where it was. It was somewhere in that state. You know, Door County's the upper peninsula for those of you who know. And I woke up 3 in the morning and I'm thinking, oh my goodness, that was at Door County. That was the digression for a second. I was looking for something to do. I couldn't go back to sleep. So we were on a house on the lake at that time. And I decided to go throw a lure out in the water in the lake. And sure enough, I got a bite and it was a trout. It ended up being like a 6-pound steelhead trout. And you hear these stories about how, you know, you catch a freshwater fish that is jumping out of the water. I had never heard of that, never experienced that. I'm a Southern boy and, you know, we would go crappie fishing. Crappie don't do that, or crappie if you call it that, if you pronounce it that way. I was very excited. It was a huge morning for fishing and it turned around my loss of sleep. Didn't matter. It was great. Now, what made me remember that over 10 years later when I woke up at 2 in the morning, it was because that fish, that steelhead trout, was just flopping in my chest really fast. It wasn't like that. It was like, and at that point in time, I knew it. I had suspected before for several reasons that, you know, I wonder if I have atrial fibrillation. Reason number one, I was somewhat of a weekend warrior endurance athlete. I had done, at that point, I had not done my ultra marathon yet, but I had done several marathons. I had done multiple half marathons. In fact, I would do a half marathon about twice a week, playing on 2 and 3 hours of full court or half court basketball. And was at my age, 40s and 50s, I was able to run circles and outlast 30-year-olds. So that was my talent, my skill set, endurance. Fast forward to a few years later when I found out that I had plaque, and then when I found out that I had prediabetes, I also did some genetic testing. That was a time in our practice when we were doing cardiogenetic testing. And I had 2 copies of the atrial fib gene. I'm not going to go any deeper into the technical stuff on that, but I had a couple of reasons thinking, maybe have risk for atrial fib. And sure enough, I had several episodes where I'd get that and then it would go away. This time when I woke up at 2 in the morning, about 8 years ago, the day I diagnosed my atrial fib, it was really clear this was not going away. So I had already bought a thing called iCardia. There are several ways to diagnose atrial fib. The biggest one, the most common one, is with what's called a Holter monitor, but that's a big piece of equipment that you tape to your chest. It's currently being replaced by some other things like a Zeo. And no, I'm not paid by any Holter monitor group or Zeo group or anybody else for any of these videos. The next thing I did was I reached into my briefcase. I pulled out this iCardia, and at that time, Apple Watch was not quite ready for prime time for doing this. I knew I had risk. It was a little electrode about that big. You put you wet your thumbs, you put both thumbs on it, and then it transmits over to your iPhone. And I was able to see my EKG rhythm strip. And there were a couple of things that were very clear. Number one, the rate was about 150. And number two, it was what we call irregularly irregular. It wasn't like you skip every third beat or you skip every other beat or any of that business. You just could not predict when the beats came through. That is a very, very clear tip-off if you're a doctor and you study these things that you've got atrial fib. And the third thing was the rhythm strip did show me it did not have the P wave, the wave that you see when your atria are contracting. Now, I'll go into a lot of other stuff a little bit later in some other videos about how do you manage atrial fib once you diagnose it? And why is it that, just like with prediabetes, most people that have atrial fib don't even know it? And again, like prediabetes, if you have it, you really want to know it because it increases your risk 5 to 8 times to be either killed or permanently disabled with stroke. And guess what? All of those things sound terrible. They sound like I'm fear-mongering. No, I'm actually doing just the opposite. We live in a world where you get into your 50s and especially your 60s, and people think, well, you know what? Uncle Joe or Tim Russert in his 50s, in his 60s, is recording the intro for his next show for Meet the Press. His producer walks in. He says, hey, what's happening? Clutches his chest, keels over, dies. That world's not necessary. We do not need to be living in that kind of world. All we need to do is understand these risk factors like undiagnosed atrial fib, undiagnosed prediabetes, and we can take that risk right off the table. So that was my my 11 o'clock Friday morning share. I've got a lot of interest here. Let me just see what I can answer. And then, we're trying to keep this fairly short because I got stuff I got to do on Fridays. But let me see if I can respond to some questions. Bart Robinson, good morning, Doc. How are you? And RX is saying something about the brain. Cap and bells, I take it when I can't sleep. Bonnie Carney, good morning from San Diego. Bobby Girl, good morning from Bristol, Tennessee. Questions about Cialis. Dr. Nelson Vasquez, hello. Hello, Dr. Brewer, how are you? JMK, so I haven't seen you on these, on the Friday ones. Can a ketogenic diet cause atrial fib to revert back to normal sinus rhythm? That's a good question. Ketogenic diets are associated with a significant decrease in inflammation. And the question about inflammation and atrial fib, you have to assume there's a whole lot of that there, but I haven't seen it. And That doesn't mean that there's no data, no information on it. I know that I think the physician formerly known as Jesus is watching. Jesus, if you can check in on Dr. Google, or if you already know about ketogenic diet and AFib, I'd be interested in hearing that too. Um, Mixel, my bruises got swollen. Well, how much plaque? My CAC was 1200. Okay, so it's a good question. I think you're asking how much plaque I have. I had one calcium score. I don't really use calcium scores very often because I use a technology that's easier, cheap. Well, it's not easier, but it's less expensive. And it tells you the one thing you need to know, Mark, as opposed to the things that you have to guess with. What do I mean by that? Calcium score shows calcium. CIMT shows soft plaque. Soft plaque is what's dangerous, not calcium. And let me just pause for just a second and answer your question. I got it once because I knew people on the show, you viewers would have some interest, like you did. It was about 100. I don't know what it is now. It's been over 5 years since I've gotten one. I might go back and get one at some point. One of the reasons, back to the reason why I don't focus so much on calcium score. We get people that come in to us. It's not the same right now. You know, things tend to ebb and flow. One of the biggest reasons for coming in to see us now is that people have learned a lot on our channel. They've gone keto or low carb. They've lost a lot of weight. They've gotten healthy and they want to get to the next level. That's probably the most common reason for coming to see us. But a few years there, up until about a year ago, actually, one of the most common reasons for coming to see us was I had a calcium score. And oh my gosh, it was over 1,000 or 2,000. We've got a couple of people over 4,000. And they would come to us and think, I'm a dead man walking. In fact, a couple of them actually used that quote. But it's after they've been with us for a couple of months or a couple of visits that they realize, hey, I'm good. I've actually gotten all of that soft plaque out of there. Most of the plaque I have left is calcified. So I'm actually at maybe just a little more risk than someone without plaque, but not much. So that's the problem with calcium score. Hey, JMK, I've been keto carnivore and notice I'm having less episodes of atrial fib. Well, Bobby Girl, thank you so much for sharing that. And Vision, can you give me some suggestion on how to start fasting for weight loss after 2 years of not fasting? Yes, and Vision, it's a great question, and most people do it wrong. We've got a great video where Dr. JV, formerly known as Jesus, shared how he did his fasting episode wrong. I did a 5-day water fast, and he decided he was going to take the opportunity to do a fast as well. He had some challenges with it. One of his big challenges was not getting totally prepped for it. And another big challenge was not staying hydrated and keep watching his electrolytes. So if you've not seen Dr. Annette Bosworth, she's really, really good. She's got a big group of people that she takes through the fasting process. I've learned a lot from her about these 3 areas. And here's a couple of things to think about. Number one, don't just go from a high carb or even medium carb diet. Go ahead and get very fat adapted first. When you get fat adapted, all these carb related episodes of the roller coaster of your blood sugar going up and down and up and down, that slows down and that just stops. And then once you're basically eating fat, you're living on fat that you're eating, it's very, very easy for your body to transition to fat in your body. So it's much, much easier to do intermittent fasting, and especially even prolonged fasting if you are completely fat adapted. A couple of other things to think about. Jesus shared on his video that he actually went out, young and arrogant and thinking, okay, I'm going to play a little bit of soccer on day, 2 or 3 of his fasting episode. And it wore him out. And he felt great for the first 2 or 3 days. And then day 3 and 4 started really feeling bad. The other thing to think about is electrolytes, as I mentioned. But when most people think about electrolytes, they're thinking about sodium or maybe potassium, rarely think about magnesium. And magnesium is a critical electrolyte for several reasons. There's some association with muscle cramps, things like that. There's also some associations with things like atrial fib, although those associations are fairly weak, but a big association with mental health. Make sure that you're getting your magnesium if you're fasting. So a whole bunch of different reasons to think about what to do when you're getting ready for a fast. Thank you for Ann Vision. That was a great question. As I said, we're going to try to keep these to 20 minutes. Let me run through and see if there's any. Bonnie Carney, my atrial fib is connected to my sleep apnea. I have dual sleep apnea. Atrial fib is very much associated with sleep apnea and 2 other things. Quite often, weight loss, if you've got any opportunity for weight loss, really helps you deal with those 2 things. And in fact, most people think atrial fib, once you get to that level of cardiovascular disease, you need drugs or you need surgery. Ablation is the most common surgery for that. They also have a thing called Watchman, where they're trying to keep you from your clots from forming in your atria. At the end of the day, believe it or not, things like atrial fib and even heart failure, both of which you think are incredibly serious heart conditions, are A, far more common, and B, far more lifestyle related. I treated my own atrial fib with lifestyle. What did I do? What's it got to do with sleep apnea? And were there any medications involved? Again, you'll have to wait and take a look at the video to get answers to that question. Okay, again, we're trying to keep it a little bit shorter for this. There's no way I can ever answer all of these questions. Thank you so much for your interest. Don't let Tony the Tiger take over your dinner. And see you in the atrial fib video.